Jonathan, so when a new physical therapist is hired, what's the process for onboarding them and training them?
Well, we have a concerted effort to hire PTs from schools that we've identified as places where they're taught the types of skills that we're looking for. So manual therapy skills primarily, and then neuromuscular re-education skills such as proprioceptive neuromuscular facilitation, because those are pivotal to how we approach the treatment of musculoskeletal injuries, and that aids us in improving people's function. Once that's done, we bring those individuals into our practice. They go through a 17-module online training program where they learn not just our treatment approach, but how we diagnose and treat various parts of the body. So there's a module for shoulders and a module for the lower back, etc. And they have to pass those modules at the level of 80%. And once they've passed all 17 modules, we then put them through a hands-on check to make sure that they've assimilated those skills into their evaluation and treatment of a patient.
Jonathan, when you hire a physical therapist looking to perform manual therapy, what do you value in a provider performing manual therapy?
I'm really focused on identifying somebody who can do a really good subjective exam, take a history from the patient. Jeff Maitland said that if you listen to a patient, they'll tell you what's wrong. And if you really listen to them, they'll tell you how to treat it. And so I want therapists to be open-minded as to identifying what the true root cause of a problem is. And they do that by listening and then observing. And all of those things happen before they even put hands on a patient. Once they've determined what's wrong with the patient by listening and observing, they then do a clinical exam to confirm what they know. And so the clinical exam then becomes just a confirmation of what they already know based on the history that they've taken.
What demographic of patients come in to seek care at Orthology?
It's pretty wide-ranging. We see little kids, but mostly sort of people in their teens and 20s. We see a lot of musicians. We see people who are injured at work, so people in their 20s, 30s, and 40s. We see people who are sort of reaching the end of their careers, who are starting to experience the difficulties of aging and less flexibility in their muscles and joints, and maybe a cumulative effect of workplace stress on the types of musculoskeletal conditions that bring them into the clinic. We also see an aging population that has maybe not even suffered an injury, but just has chronic pain from years of faulty movement, maybe some deconditioning that's resulted in some asymmetry in their body, maybe some of the recreational sporting activities that they've engaged in. So, for example, someone who plays racket sports and is right-handed is typically going to have right-sided hip and low back pain because they pivot on that joint more than they do on the other side. Somebody who does something asymmetric, like plays a musical instrument that is set up asymmetrically, is going to have different problems on one side of their body to that of the other side. And so being aware of what they do and being able to demonstrate what they do informs how they got injured and what types of problems they are experiencing, and that informs the type of treatment that we're going to use to correct them.
Jonathan, what is the perception of physical therapy, especially in the United States, and has that changed over the last 10 to 20 years?
I think in general, the United States approach to physical therapy is much more of an exercise-based approach. So a lot of strengthening and stretching exercises, treating most injuries like they're a weakness that needs to be strengthened. Orthology focuses very much on a more of a Commonwealth style of physical therapy where you're identifying the root cause and you're using manual therapy techniques to resolve tissue and joint restrictions, using neuromuscular re-education to reset the neurology around a joint. So muscles that are under-recruited are more recruited, and muscles that are inhibited are recruited using various manual resisted techniques, and then using joint mobilization techniques to restore joint range of motion. Once those things are taken care of, the functional restoration using strengthening and stretching become much easier to execute for the patient because they don't hurt anymore, they don't have that fascial restriction, and they don't have that joint restriction. So we've really adopted a Commonwealth style of physical therapy that's very popular in Australia, New Zealand, South Africa, and Western Europe, as opposed to an exercise-based style of care that's persistent in the United States.